Welcome back, everybody. This is Desk Careers from Dubai English Speaking College, and I have another exciting spotlight speaker for us today. You might recognize him. His name is Dr. Manos, and he comes from the Modern Veterinary Clinic here in Dubai. Welcome, Dr. Manos. Welcome to our digital spotlights.
My pleasure to be with you. Good morning.
It's so exciting to be here, especially at this time of the year. We have a lot of young students considering their next steps towards their future careers. And we have a lot of aspiring medics, but some of those medics are also thinking about careers working with animals. So I know it's really, really exciting to have you talk to us a little more about what it's like to do the work that you do, and maybe give us some insight into the industry. So thank you for joining us.
My pleasure. So, first of all,
let's start right at the beginning. Who is Dr. Manos?
Dr. Manos is a Greek guy, came 5 years before in Dubai to join Modern Veterinary Clinic. It was the first time that I left my country. I didn't know the meaning of the business here, but I adjusted in no time. And trust me, from the way that I was working and I knew that I'm going to work, I didn't have any issues since ever. Our business, the veterinary science and the veterinary business, is very tricky because you are dealing with a person, a patient that doesn't speak. You have to interpret many things. You have to listen to the owners, thus parents. Don't forget that sometimes we're collecting information from the parents of the pet that could lead us to diagnosis better than what we are doing and what we are consulting. It's nice, it's very interesting, very tricky. Nowadays that we have MRI or CT scan or anything that also in human medicine they're using, we are having information about everything in no time. The veterinary science is difficult. Don't forget that, yes, here in Dubai, in this clinic, we are dealing mostly with dogs, cats, and sometimes with exotic animals. But it's not only this field of the veterinary science. The veterinary science has to do with all the wildlife, has to do with the dairy products, has to do with the cows, sheep, goats, camels, everything. Wildlife, very interesting. And nowadays that you could also be a specialist and have your diploma as a diplomate in any field. The chances that you have is to get and be an ophthalmologist or a cardiologist or an exotic vet. It's amazing. We have many fields. So for the new vets or wannabe vets, the field and the dream is huge. They can do whatever they like.
That's amazing. That's really, really amazing. Let's bring it back to where it all began for you. So how old were you when you knew this is what you wanted to be doing? Because I know that this is a question that a lot of young people ask. So what about you? How old were you?
Okay. The family background, my father was an OB. So since ever, I knew that I'm going to be a doctor, human doctor. 3 years before I finished school and when I had to start thinking about my future, I tempt myself to do something harder than human medicine. And I chose because I knew that I'm going to be a doctor from the beginning. That was my destiny. I chose the veterinary science because it's way much more difficult than the human medicine. By accident, good, because I was raised with dogs and cats at home, probably. But I never regret my choice. I stayed committed to my choice. The university is extremely tough, to tell you the truth. But even during my studies, that Many times I had failed with exams and all this stuff and had to repeat again and again and again and again. I never regret. And I have seen. Are you here? Yeah.
I'm right here.
I lost you for a few seconds. And I have seen through all these years that I'm happy in the end. At the end of the day, when I finish my shift and I go home, I'm happy with what I have done, with what I have seen, and I will never regret and change my choice that was from the beginning.
That's amazing, and I'm hearing the confidence in knowing that you made the right choice, and that is really the ultimate goal for our young people thinking about their future careers at Dubai English Speaking College. Is we want them to turn around one day with that kind of confidence, but it doesn't just happen. It's a process, right? So you talk to us about growing up with a medical surrounding, your dad being a doctor, and knowing that it was your destiny to go into medicine. What would you say as a young student, if you could go back and think, there are very specific subjects that you would have paid more attention to? Not the sciences, the other subjects that you know are very, very useful in the everyday job that you're doing with animals.
Okay, let's begin with the fact that I'm Greek. Okay, that means that the way that I was raised and treated from the side of my family, I was not 100% committed to what I was doing. Meaning that I had my social life during university. I was going out, I had friends, I was partying, I was doing everything. But the main goal for me, and I believe that for any new student, is the studies. But if you lose your personal life, this is my belief, if you lose your daily contact with your friends, your family, you're going to lose half of your life. So be committed to your studies, because as I said before, the university is very tough. All the veterinary schools are extremely tough schools. But in the end, there is a balance in between studies and our personality.
So
I didn't lose anything.
Great, that's fantastic. So would you say that subjects like business or languages would have been really useful for you to be learning in the role that you have right now?
Business. Business, I would very much like to know how to run a business or something, but this is something that you could study after you finish your medical studies, because it's different, way different. And you need experience to many fields. Languages, yes. The only language that I didn't manage to learn in all these years here is Arabic, unfortunately. And I wish that I could have the opportunity to study the basic one. Good morning, how are you? To have a normal conversation. I'm not talking about having a very deep analysis to something, to a thesis or something, but I'm talking about that I could speak and introduce myself and what I'm doing, but in Arabic.
So talk to us, talk to us about the other job roles that exist at the veterinary clinic. So I know that there are going to be students.
Do you want me to take you for a virtual tour? Should I take you for a virtual tour?
Let's do it. I think that's a great idea. Let's go on a virtual tour. So for anyone watching, Dr. Manos is going to take us on a virtual tour of the clinic so that we can see the different job roles in action. And while you're doing that, maybe talk to us about some of the job roles that we'll be introduced to.
Yes. So this is the reception. Okay, and the reception for any business is the heart of the business. Meaning, the ladies here, they are booking the appointments. They have to be very strict. They have to understand what the clients are asking for, and then they could make our lives easier. Not bad at all. Okay, and this is the first, let's say, picture that you have when you come in the clinic. It's the reception. So now we're going upstairs, that we have our hospital and surgery field and everything. Wait.
So fantastic. Anyone watching, Dr. Manos is taking us on a tour of the clinic to see the different job roles in action. So we just met the first protocol are the receptionists who greet the humans that come in with their animals, and they're the first and probably the last impression they see when they're leaving the clinic.
You're stuck. Maria?
There we are. We're back on again. Yeah.
Okay. Did you see the cat hospital?
Unfortunately, no. I think we just got a little frozen there. It looks like technology is playing on us. Dr. Manos is trying to show us his surgery, where all the surgeries with the animals are being done.
Okay, so, but I cannot see you.
That's
Can you
okay.
see me?
I can't see you, but let's talk while we're waiting for the video to come back on.
Came back. So, hello?
Talk to us about what's happening right now, Dr. Manos.
They are preparing a cat for Spain surgery. And these are our surgery fields. We have 2 surgeries, the theaters, and this is Dr. Joao and Jeffrey. Jeffrey is a nurse, but they're starting now, or in a while, they're going to start the surgery.
What do nurses do in a veterinary clinic?
They are our right hands, our wingmates. They do everything. Treating. Okay, we're going to consult, we're going to make the differential or the diagnosis, and then we're asking from the nurses to maintain the health of the animal. They have to give the medicines, they have to clean, they have to feed, they have to inform us for any change that we could have. And trust me, they do half of the job.
What type of training would a nurse have to go through? So for somebody watching this that thinks, I want to work with animals, but I don't want to be the doctor.
There is, if I'm not mistaken, and I'm not mistaken, there is a uni for veterinary nurses. Most of our nurses here are human nurses. We have 2 vets that they're working as nurses. So you could, the job here, it's multitasking, and you could fulfill your stuff with anybody from, let's say, the ones that they are making the public relation. Of course, we have a manager, we have an accountant. It's a business.
It's a business. It is.
Okay. Tell me.
Talk to us about you being a veterinarian and working in surgeries. For anyone thinking this is a career that I want to go into, what would you say are the top 3 characteristics that they need to be enhancing to be great veterinarians?
Skills, mind, and very cold blood.
Tell us more. What does that mean?
Okay, skills, of course. For example, if you are a pathologist, you need to read, you have to go to daily you have to read. And I'm not talking during the studies, but I'm talking after studies. You have to be informed about anything new. You have to make many things at the same time. Brain, the mind that I said before, brain, because you have to combine things and you have to be very fast. Your decisions are have to be taken in milliseconds most of the times when you're in the surgery, for example. and you have to decide what to do. And cold blood. You know that our science is one of the top stressful sciences ever. Okay, the statistics are against the vets, to tell you the truth. But knowing that you are dealing with unprotected, sensitive, fragile beings like animals, you have to be very careful with what you are doing. If you get attached, and at the beginning you are going to be sorry because something went wrong, or you are going to be sad with the owners because. Okay, a very simple example is that their life expectancy is not like ours. So when I'm dealing with a dog that's 15 years old, that in human age, I could say that is 90. But for the owner, it's only 15 years old. This is the difference. So if you let the feelings of the owner stress you and choke you, you are going to be not objective, but subjective. And for all medical field, you have to be very, okay, I have to say it in a very polite, in a very rounded word. You have to be very cold-blooded. Alas, that's it. It's very simple.
And how would you recommend young people develop that ability to be professional and not get emotionally attached?
Unfortunately, this is only by the experience is going to bring you this emotion.
Fantastic.
At the beginning, all of us, even now, there are cases that I'm getting sad with what I have to do or what I'm doing or with the loss of an animal till now. But at least I'm trying not to affect my life, not to affect my job. And trust me, because I'm many years in the field, I will never jump this feeling. It's going to be there forever. But at least I know how to compress everything down.
So great. So great. Okay, Dr. Manos, we're coming right to the end of our interview. I know you're busy, you're at the clinic. Top 3 tips. What do you want young people to remember from your time as a veterinarian?
Study, and love what you're going to do. Whatever is this that you're going to follow as a job, or from plumbing, for example, or gardening to a brain surgeon, you have to love what you're doing. If you don't love what you are doing, you are never going to succeed. So be committed to what you like, not what your parents like, what anybody else likes, what you want to do.
So great. Thank you so much, Dr. Manos. For anyone just tuning in, that was Dr. Manos from the Modern Veterinary Clinic here in Dubai. If we have cats or dogs, or what other types of animals do you treat at the clinic?
I told you it's mostly dogs and cats, rabbits, birds.
Where can we find you, Dr. Manos? Where can we find the Modern Veterinary Clinic?
The main branch is in Al Wasl Road, and the second branch is in GLT.
Super fantastic. So watching us right now, you can see below us the website where you can reach out, and feel free to reach out. I know that I am a client of Modern Veterinary Clinic, and my pets have been they've been your patients for quite a few years. So I have always wanted to bring Dr. Manos to be a spotlight speaker because, as he said, working with animals, they become our children, don't they? Thank you so much. Anybody watching, I hope you enjoyed our digital spotlight, and I look forward to seeing you again when we bring another amazing spotlight speaker to our digital platform. Have a great afternoon, everybody.